Hi, my name is Jamie Solis, and I will be giving a demonstration on donning and removing PPE in a clinical dental hygiene setting. I expect that the students take this demonstration very seriously and understand the importance of these steps, as these will become a part of their everyday clinical dental hygiene routine. Improved personal safety in a healthcare setting increases patient safety. PPE, which stands for Personal Protective Equipment, is specialized clothing or equipment worn by employees to protect themselves against infectious diseases. Maintaining proper PPE and hand washing technique is vital to maintaining a professional and safe environment. It will show that your patients are respected and that cleanliness is an important part of the dental hygiene appointment. It is necessary to understand the order of these steps of donning and removing the PPE to avoid cross-contamination to themselves, staff members, and other patients. Contaminated areas will typically be on the outside of the PPE, and clean areas will be on the inside. Grading on this skill test will be based on the steps performed in the correct order, ensuring that caution is taken to avoid cross-contamination. Students will need a lab coat, protective eyewear, mask, soap, paper towels, and treatment gloves. Donning your PPE should take place prior to contact with the patient. Therefore, it would be ideal to have your patient seated in your operatory before donning the PPE. The first thing we will do is put on our lab coat. When you are donning your lab coat, it is important that you button the lab coat completely. Next, we will be putting on our safety glasses and mask. When you are putting on the mask, it is important to ensure that the flexible band is across the nose and that the mask fits snugly across the face and underneath the chin. Next, we will be performing hand hygiene prior to putting on our gloves. It is important that when you are performing hand hygiene, it is done properly, ensuring that you are rubbing your palms together, interlocking your fingers as well. Hand washing technique should take about 30 seconds. Once you have completed washing your hands, dry them off with a paper towel. Prior to washing your hands, you should ensure that all jewelry has been removed. Now that our hands are clean, we are able to put on our treatment gloves. Once you have donned the treatment gloves, it is very important that you avoid touching your hair, the patient's chart, or other extraneous objects. Now that we have properly donned our PPE, we will discuss how to properly remove your PPE. First, you want to take your gloves off, and by doing so, you want to grasp the cuff of the gloves to avoid touching any contaminated areas. Roll the gloves over the hand and remove very slowly. Next, remove your mask by grabbing the ear loops and pulling forward. This will allow you to avoid touching any contaminated areas. Next, we will remove the safety glasses by grabbing the ears, the parts next to the ears. We will place these on a paper towel, that way they can be washed and cleaned later. Next, we will wash our hands again, performing the same hand washing technique that we did prior to donning our PPE. Ensuring that these steps are completed correctly is very important as a dental hygienist. This will ensure that you are safe as well as your patients. Thank you.